Hi, Instagram and YouTube. It's Howard Gearhauser here alongside my dad, Dr. Richard Gearhauser. Today, we wanted to talk to you guys about 5G. I know a lot of content around 5G has been taken down, so hopefully this will stay up, but more specifically, how 5G is linked to COVID-19. So, Dad, you ran across some interesting articles. Could you elaborate on what's going on here?
With it. But what I'd like to talk about is someone published on their blog. So it's Dr. Havas. So Dr. Havas, you can Google him, and he has been an expert on the electromagnetic fields that man makes and how they affect health. And he has a blog. And today on his blog, or yesterday, as of April 21st, he had calculated the COVID-19 related to 5G. So he looked, we know where 5G is now operative, and it's in about 30 cities in the United States. So 30 cities have it going and blasting. Of course, some cities have way more than others because some cities have 4 providers and they all have their own 5G system. And we're not talking about 5 gigahertz, which is the 4G. It's not that frequency. 5G is just another system of using these higher frequency waves. And the problem with the waves is they're pulsed. And in nature, waves are never electromagnetic waves, are like the electromagnetic waves our heart creates, electromagnetic waves our brain creates. They are never pulsed. So there's a concern that maybe pulsing these waves will have an effect on our health. And so there's hundreds, if not thousands, of scientists that have read the literature and are concerned. And I've signed these petitions that, hey, we need to test this for safety. But because it's an emergency to get 5G going, because it's going to so radically change how we can control things, that the country that gets it first is going to have the upper hand, theoretically, on a lot of things. So the government doesn't, at this point said, hey, this is like, running from the tiger. So you're on a lava bed with bare feet, and there's a tiger, and you've got to sprint across this lava that tears your feet into shreds, but you got to do it. Otherwise, you're tiger bait, going to be eaten, but then you'll be part of the tiger. Not so bad. I relax and just go with the flow. But, you run across the lava bed and slice your feet to pieces because, it's an emergency. And so that's how the United States feels about 5G. And maybe that's right. Maybe that's true. And maybe we do have to do this. So what do we do? Well, I'm not going to tell you what we do. Let's first talk about what did Dr. Havas find with his little statistical analysis of 5G cities versus non-5G cities and the rates of COVID-19. So I'm only going to just briefly discuss this. So the COVID-19 cases per million population were 95% higher, which means they're almost doubled, 95% higher in the 5G cities versus the non-5G cities. And the COVID-19 deaths were 126% higher in the 5G cities versus the non-5G cities. So more than double the death rate if you happen to be in a 5G city. Now, that doesn't mean that much to each individual that you double your risk. Your risk of dying is, 0.1% or less. So it's not I'm not trying to give you any fear. It doubles your risk, but the risk is small. So it's not that big a deal for you as an individual, but for you as a seeker of optimal health, should we study, should we get together with China and say, hey, let's sign a pact saying, to roll out 5G everywhere without knowing if this is a real thing, and this is preliminary, it's just looking at the data, and it's not necessarily a valid study. It's not a prospective, what we call prospective, where you look at things before they happen. Those studies are much more valuable than when you look back, a retrospective study of, well, what happened? It gives us hypothesis. That's about it. So the hypothesis here is 5G has some sort of effect on making us more vulnerable to the COVID-19. And we're going to get beamed from it from outer space, which we can't go out in the woods into our, we can't become the Unabomber and try to separate ourselves from society. We can't do that because it's in space. It's going to still zap you. So what do? Get a freaking metal roof on your house as soon as possible, or at least line tinfoil on your ceiling. I'm going to work on that project next week.
Yeah, wear a tinfoil hat also, and or live in a tinfoil bubble, another option. But yeah, I mean, we don't know exactly what's going on with the 5G in terms of the health risk. Again, this is a small sample size of potential risk. Right now, still get out in nature. That's our go-to strategy, right? Get out in nature, clean up your living environment from 5G, your wireless router, things like that. Turn them off if you're not using them. There's no need to add artificial waves and electromagnetic fields in your dwelling environment unnecessarily. So get out in nature, try to clean up your living space, and we'll just kind of have to see how 5G progresses as time goes on. Is there anything else you wanted to add to that?
Yeah, so I was being slightly facetious about the metal roofs, but the metal roofs might actually be a good way to go down the road. If the government says, the heck with you, we're rolling this out and we know more and more that it's creating problems. The metal roofs are not that hard to do. Gluing tinfoil to your ceiling, that's pretty easy. It looks pretty cool. It looks like maybe you're already out in space with your ceiling. Looks like tinfoil, like the stars shining when the light hits it at sunset. It could be beautiful. And it could be that 5G is the savior of mankind, in that it leads us to some kind of consciousness expansion. So it was, it's something nature is doing or the cosmos is doing, or God is doing as a kind of a necessary evil to get us to a different level, pure speculation. So I don't judge things that I don't have the ability mentally to judge or spiritually to judge. So I'm not judging it, but I'm being cautious about the matrix doesn't always care about the individual and will sacrifice the individual. So we want to help you guys. Just be aware. Be aware. Hey, little tinfoil on the ceiling of your bedroom, that's not such a hard thing. I haven't done that, but after seeing those satellites and thinking, wow, what can I do? Well, maybe I could put tinfoil inside my tent or interesting.
Yeah, well, I think
we live in interesting times we live in.
In the best defense too, rather than dwelling on these man-made waves and what they may or may not do, is just to focus on strengthening your own electromagnetic fields, especially the one in the heart, which is our most powerful native EMF. So reducing stress on the heart and reconnecting with nature is going to strengthen your own field. And it might be more strengthened against non-native or less susceptible to being distorted by non-native or having it tamper with communication. So that's something to think about too, just being proactive, and we'll see how the other stuff rolls out. I think that's it for this one, Dad. You good with that? Cool. Yeah. All right, guys. Thanks for tuning in. We'll see you on the next one.